We have so many types of stitches, but I'll be teaching you the most four-handed type of stitches that wherever you find yourself, whatsoever situation you find yourself, one of these must be of use to you. So we have simple interrupted stitch, we have simple continuous stitch, we have figure of 8 stitch, and we have interlock stitch. So calm down, we are going to practicalize it together. And when you want to start suturing, you should have something in mind. That is the place you want to suture. How is the patient not going to feel pain? That is where you get your lidocaine. So now, the universal practice is that you withdraw 2 ml of lidocaine and dilute it with 2 ml of water for injection, making it 4 ml, right? But that is not commonly practiced because most of the patients you want to attend to take alcohol, or maybe they are alcoholic. So that diluted dose do not really work for them, except maybe you want to suture a child. So here is your lidocaine. You've withdrawn your lidocaine, right? You need 4 instruments that you are going to use for this suturing, which are a toothed dissecting forceps, like, can you see the dissecting forceps? I believe we all know a dissecting forceps. So do you see the tooth again? And you need your needle holding forceps, like your needle holder. Can you see your needle holder? So how do you differentiate an artery forceps from a needle holder? See, you will see one line here inside, like a deep cut inside. Yeah, can you see? That is what makes it a needle holder. If it's an artery forceps, that tiny line inside, that I really want you to see. I don't know if this camera is really doing justice to it. Can you see that cut inside here? So that is your needle holder, and that is what we'll be using mostly in this procedure. And you need your scissors. I don't have a scissors with me right here, so I'll be making use of a razor blade. You can also use your surgical blade if you do not have a scissors, but I'm using a razor blade for this procedure, and or maybe an artery forceps, but you can still do without it. Let's give it a cut. So let's assume this is the skin. So this is the cut we are suturing. So you're going to do is to inject. Then you start injecting. As you're injecting, you're coming out. Then you do that for the downside. Then you do it for this other side as well. Like you do it for the other side as well. Then depending on the wound, you can still go this way, this way. Let's open our suture. And don't forget to wear your glove. You know I'm not doing this procedure on a patient. So this is what it looks like. This is it. So once you open it, you're going to see this sharp edge, what they call, and the rope. Can you see the rope? So what you're going to do is immediately you open it. What did I call this again? So now you will carry it and clip it. Can you see? You clip it. This, can you see? You clip it. So once you're done clipping it, you drag it out from the paper. When you want to start suturing, you will look for the apex. That is where the cut starts from. Can you see? Where the cut starts from, that is the apex. So that is where you're going to be picking first to start the suturing. So, I hope you can see. This is my apex. This is my apex. So you're going to go in. Can you see? Then you come out at the other side. Pick it at this side. Can you see? Then you come out at the other side. Can you see? So once it comes out, you now use this your forceps to press down the skin. And once you press down the skin, you use this forceps to go and pick it up. Then you drag it. So you ensure that it's just small that is remaining at this other end. So this other end now, go around the forceps twice. Then you pick this other end, this remnant, you pick it, then you clip it. So after clipping it, you drag it. Can you see? Then you go again the second time. You roll it twice, then you pick it up. You drag it. So you can go like twice or 3 times just to secure the stitch to ensure that it is very strong. So yeah, I prefer using my hand though. So if you can go, then you drag it again. So you have successfully done a simple interrupted stitch. You go in with your scissors and you cut the longer part, you cut. Then you also cut the smaller side. So this is a simple interrupted stitch. So the difference between simple interrupted is that you go again. Press it down, move it, use this one to pick it. Then you pick it, you drag it. You go again, pick it, you roll it, then you pick it. So don't mind this first one. No? So this is a simple interrupted stitch. That is, as you're stitching it, you're cutting it. As you're stitching it, you're cutting it. So let's do simple continuous stitch.